Further amendments? Ms. Capps, you have an amendment at the desk.
Mr. Chairman, I have an amendment at the desk, and it's marked Capps 001.
Clerk will report the amendment.
Amendment offered by Mrs. Capps. At the end of Title V of Division C, add the following subtitle: Extension of Wise Woman Program. Section blank. Extension of Wise Woman Program. Section 1509 of the Public Health Service Act 42 U.S.C. 300N through 4A is amended 1. In subsection A, by striking the heading and inserting, quote, in general, and B.
Without objection, the amendment will be considered as read. Gentlelady from California is recognized for 5 minutes.
Thank you, Mr. Chairman. This language of this amendment would increase the authorization.
Gentleman from Louisiana reserves a point of order.
Thank you again. This language would increase the authorization level for CDC's Wise Woman program, which provides basically 3 things: cardiovascular disease risk factor screenings, second, healthy lifestyle programs, third, healthcare referral services. And it would provide this program to uninsured and underinsured women ages 40 to 64 years. The CDC currently funds 21 programs in 19 states and 2 tribal organizations, but the success of the program warrants its availability to women throughout the United States. It has been proven to save women's lives at a cost of $4,400 per estimated year of life saved, as opposed to a much higher bypass surgery expense of $26,000 per estimated year of life saved. And just this past week, Secretary Sebelius highlighted the program as a health care success story. She released a report pointing to Nebraska's program, which has screened over 19,000 underserved women since its inception in the year 2000, and during this time has significantly reduced the incidence of chronic disease and early death. As we work to improve our nation's efforts in prevention and wellness, we don't need to reinvent the wheel. We can build off programs that are proven effective. So I urge my colleagues to support this proposal for increasing authorizations levels for Wise Women so that we can replicate a very successful program in more parts of the country. And I yield back.
Gentlelady.
Or I yield to someone.
Gentlelady yields back her time.
I yield back.
Mr. Barton.
Mr. Chairman, I rise in reluctant opposition to this amendment. We are not opposed to the extension of the Wise Woman program. Problem with this particular amendment is in the authorization section beginning down at line 16. My understanding is the current programs are authorized and are expending in the neighborhood of under $20 million a year, and I would ask the council if they could confirm that. Do you know what these programs are spending right now?
I am told that the appropriation for fiscal 2009 was just about $20 million.
$20 million. That's 3 zeros different than $20 billion. Okay.
But I apologize.
That's my understanding also.
The labor agency appropriation passed on Friday out of committee for 2010, and I do not know that number.
Okay. Well, I'll ask the author of the amendment, or authoress of the amendment, do you know what the latest HHS appropriation that just passed is for these programs?
I don't know exactly what the current one is. I think since it just passed last week, we should be able to find out for you, sir. But the CDC says that increasing the funding to $85 million, as this amendment would do, would allow the Wise Woman program to increase the number of women screened by an additional 25%, and that would provide screening services to all eligible. Well, and that would allow all eligible women. It would cost about $200 million total.
Well, reclaiming my time again, we're not opposed to to this program. We're not opposed to the reauthorization of this program. Our problem is a fiscal conservative. If we're spending about $20 million a year, an authorization level, if you want to double it to $40 million, that would seem to me to be a sufficient 100% increase in 1 year of authorization would seem to be rather substantial, but quadrupling it does seem to be a little bit much. And so for that, you know, our problem is with the amount of the authorization, not with the underlying program itself. So we, at least I oppose it based on that grounds.
Further discussion? Are we ready to proceed to a vote?
Well, could I, Mr. Chairman, or if, on his time, if I could just say once again,
I'd be happy to yield.
there is an estimated cost savings for every woman's life who comes under the program, and that you know, the cost of a bypass surgery at $26,000 a piece as opposed to $4,000 extension of their lives, the cost per participant is about $400. So however much we extend it, we're going to be adding benefit far beyond the cost of the legislation. I'm not sticking to the absolute number. The more women who are exposed to this program, who get the benefit from it, it's something that has been demonstrated to be cost effective. I believe it is something that is well worth our consideration.
Well, before I yield back, would the gentlelady accept the unanimous consent request to change the authorization level to $40 million and then increase it each year by $5 million a year?
Forever?
Well, for the
Just kidding.
through the year 2014.
I'm just kidding. You know, whatever seems feasible. The ability to add a significant amount would, in my opinion, be worth it, the time that it's taking us to consider the legislation.
Well, I mean, you'd double the authorization and then increase it for $5 million each year for the next 4 or 5 years. Within that,
It's talking about the number of women we want to reach
okay.
and the value of their lives.
So you would object if I made that unanimous consent request?
I would object.
Okay.
Let's
I yield back, Mr. Chairman.
Let's proceed to a vote. All those in favor of the CAPS amendment say aye.
Aye.
Opposed, no.
No.
The ayes have it, and the amendment's agreed to.